everyone, welcome back to the Tox Lab. I'm Rebecca.
I'm Rob. So Rebecca, you ever been foraging for mushrooms?
No, can't say I have.
Foraging for any food? Blackberries?
No, I'm not that outdoorsy.
No, that's true, you're not.
What do you mean by that?
And another question.
Mm-hmm.
Do you like beef Wellington?
Yeah.
In case you haven't guessed already, this week we're going to be taking a look at what has become quite a famous case, the Erin Patterson case, and taking a bit of a deep dive into death cap mushrooms.
Before we jump into today's episode, if you want to stay up to date with our content, you can find us on Instagram at _tox_lab. We also have a LinkedIn page. And for those of you who don't use social media but still want to get in touch, you can email us at thetoxlab@gmail.com.
So the Erin Patterson case coming out of Australia, very recently, the trial has concluded. Mm-hmm. We're not going to dwell too hard on some of the finer details. We're not going to get bogged down into guilt or innocence, but we did want to have a look at some of the facts of the case because it's a very, very unusual case as toxicologists to come across. Rebecca, why don't you run us through some of the facts?
On the 29th of July 2023, Erin Patterson cooked beef Wellington for lunch with her in-laws Don and Gail Patterson, Gail's sister Heather, and her husband. The following day, all 4 guests were admitted to hospital with suspected gastroenteritis. They then subsequently developed liver failure, which then developed into multi-organ failure. Gail and Heather sadly died in hospital 5 days after the lunch, with Don dying a day later despite receiving a liver transplant. Ian did manage to survive, but was in hospital for about 7 weeks. Erin was then charged with 3 counts of murder and 1 count of attempted murder, for which she was found guilty of on the 7th of July 2025 after a 10-week trial and a week of deliberation. The culprit, death cap mushrooms.
So as I say, we're not going to get too bogged down into some of the finer details of the case, but from what I understand, actually the cause of death in these cases is not under dispute here.
Mm-hmm.
So 4 guests fell ill, all having eaten the same meal. 3 of them died. 1 of them was very, very unwell, but did survive. And this case really got global attention, didn't it? And there's a fairly good reason for that. It's actually not very often that a mushroom is your murder suspect. So what are death cap mushrooms?
So death cap mushrooms, also known as Amanita, phalloides, sorry if I've completely butchered that, is thought to be one of the most poisonous mushrooms and unfortunately resembles several edible species of mushrooms, so can be easily mistaken for things when out foraging. Death cap mushrooms contain a couple of different toxins that are responsible for their effects. So one of these amatoxins, which are quite large multi-ringed peptides, the main ones being alpha-amantin and beta-amantin. And these mainly act to inhibit RNA polymerase II, which is required for the synthesis of mRNA, microRNA, and small nuclear RNA. And the production of these is essential for protein synthesis, and a lack of these will prevent metabolism and cause cells to die. And this often happens in the liver. It's the first organ that the toxin encounters after it's been ingested. So that's the primary organ that's affected. And interestingly, these toxins aren't degraded with digestion or heat. So cooking them doesn't render them inert.
So I want to dive into the liver bit for a minute and explore a little bit why the liver is the primary site of the toxic effect. Now, a friend of mine recently, and listener of the podcast actually, said to me, Rob, what does a liver do? And it actually was a very, very good question. You can come up with textbook answers, can't you? You can say it degrades poisons and it produces essential blood proteins and it creates bile for digestion. But at its heart, what the liver is really, really good at is synthesizing proteins to perform all of these essential functions. Mm-hmm. And as you say, the amatoxins, they bind to RNA polymerase and stop it working. And so you completely stop the liver being able to do what it does. Crucially, of course, proteins are also responsible for the homeostasis within the cells themselves. So fairly quickly, the cells stop being able to do their job and actually start dying.
Another toxin found in death cap mushrooms is phallotoxins, and these have a 7-peptide ring structure, and these are also highly toxic to liver cells, but are not absorbed through the guts and aren't thought to play a role in how death caps poison people.
And actually, I just want to go back to a point you made that I completely disregarded. Mm-hmm. They're not inactivated by heat.
No.
So if you are foraging and you pick mushrooms and you cook them, they will still be poisonous.
Yes. And I think that's part of what makes death cap mushrooms so dangerous, is that by cooking and digesting them, you're not going to get rid of the toxin.
So death caps are relatively small mushrooms, pale green or yellow cap, white gills. They're not what people think of when we think of poisonous mushrooms. Typically, if I said to you, what's a poisonous mushroom, people so often imagine fairy tale toadstools, red, white spots. They are also poisonous, though nowhere near as poisonous as death caps. Death caps actually just do resemble edible-looking mushrooms. And actually there are quite a few edible mushrooms that look very similar to death caps, which is one of the problems. They grow pretty much worldwide, native originally to Europe, we think, but found quite commonly in the US and, obviously, as the Erin Patterson case has shown us, also present in Australia. More than 90% of fatal mushroom poisonings are caused by death caps, so they are overwhelmingly the majority.
On average, one person dies a year in North America as a result of death cap mushrooms, and about 30 grams or half a cap is thought to be enough to kill a human.
So relatively little. These aren't big mushrooms either. The symptoms of poisoning actually come in 3 phases. The first phase, normally about 6 to 12 hours after ingestion, is a gastrointestinal phase. So nausea, vomiting, diarrhea, quite severe, but could be mistaken for gastritis, food poisoning. 12 to 24 hours later, there's actually a latent phase, or sometimes called the honeymoon phase, where patients actually recover and the GI symptoms subside. They start to feel a bit better. But then 2 to 5 days later, the real issues start happening. Liver failure kicks in, develop all of the symptoms consistent with acute liver failure. So jaundice, disordered clotting, you can get encephalopathy, and also renal failure can also develop. Kidneys are also another highly protein synthesizing organ, so they also can become quite susceptible to the amatoxins. And normally, by the time you get to the point where the liver has started failing, it's often too late, and death following liver failure normally occurs 6 to 16 days after ingestion, so quite a period of time.
And I think with that also is a problem in itself, that people will have these gastro symptoms, will then feel fine, and then will start presenting with jaundice and symptoms of liver failure. And it's not always necessarily put down to the mushrooms they might have consumed days before. So in terms of treatments, if you know that you've ingested mushrooms that you shouldn't have quite early on, gastric decontamination with things like activated charcoal have been shown to be really effective, but only if caught early. And most people do present quite delayed, so it's not always useful. A lot of the treatments are mainly supportive, so things like rehydration, correction of electrolyte imbalances, acid-base disturbances, medications to improve disorders of coagulation. And there are some treatments out there that have shown to improve survivability. IV psilocybin from milk thistles has been shown to prevent uptake of amatoxin by liver cells, and also stimulates DNA-dependent RNA polymerases, which increase the RNA synthesis and therefore protein synthesis.
And I found this to be really interesting. It's not often a herbal remedy because, of course, milk thistle has been used for a long time as a liver-improving herbal remedy. This isn't like aspirin where we've taken something natural and turned it into a drug. This is almost straight out the plant extract, showing a remarkable ability to actually not only block the uptake but actually enhance the enzyme that's being interfered with. It's not readily available in the UK. It's not licensed in the BNF. I'm not sure how many hospitals will stock it. Interestingly, it is licensed for use in Germany.
Oh, okay.
I don't know whether Germany do a lot of foraging and therefore need it.
I don't know.
I think the caveat with this would still need to be given quite early because you still need to block the uptake of the toxin to the liver, which means you need to do it relatively soon after consumption.
Yeah, for sure. And liver transplant is often the only treatment for a lot of these patients because the liver damage has already occurred and is quite severe.
Yeah, by the time the patient's presented, often that's normally it, isn't it? Liver transplant is really the only option.
And this isn't quite as uncommon as you'd might think. Some data out of Warsaw looking at acute liver failure occurring between 1994 and 2021 that resulted in a liver transplant showed 21 people needing a liver transplant as a result of death cap mushroom poisoning, whereas only 18 due to paracetamol toxicity, for example. So it is fairly common in some places.
Wow. Okay. We haven't really talked about this, but I guess we should. These are mostly foraging gone wrong, right? These
Yes,
are not
yeah.
often homicide.
No. So there are some notable historic deaths that are thought to be due to death cap mushrooms. So the Roman Emperor Claudius was very fond of eating Caesar's mushrooms, and it was thought he'd been fed a meal of death caps or poison prepared from them, and that had been added to his meal, and that's what brought about his death. Charles VI of Austria experienced quite severe indigestion after eating a dish of sautéed mushrooms, which led to an illness that he died of about 10 days later, and it's thought by historians that was the result of death cap mushrooms.
The timeline fits, doesn't it?
And that did then trigger the War of the Austrian Succession.
So we have managed to find some poison control data, haven't we, that was published a little while ago, looking at some of the death cap mushroom presentations and stats. This is US data, I believe?
Yes, this is from the California Poison Control System.
Possibly may not apply to places where they apparently forage mushrooms more, like Warsaw.
So this paper looked at data from the California Poison Control System from January 2013 to February 2023. They used search terms including mushroom poisoning, amatoxin, and the Latin name for death caps, which I'm not going to repeat, with ingestion as the route of exposure and management of these patients at a healthcare facility.
I just want to clarify something slightly. Ingestion as the route of exposure. Does that imply there are other routes of exposure?
I don't know whether there are only for mushrooms, but they can narrow down the data as whether it's been ingested or whether it's like skin contact with mushrooms or...
Of course, because this is calls to poison control centre.
Yes.
So actually, it's entirely reasonable that a parent may phone to say their child has picked a mushroom or something.
Yeah, and they've like got horrible skin reactions. They're trying to limit it to death cap mushrooms, which work through ingestion.
I understand. Thank you.
Excellent. So 61 calls of possible exposure where individuals had been evaluated at a hospital were identified. Late fall to the end of winter was the most common time of year for these calls, and all but one were from Northern California, and they did seem to be seasonally clustered, with December 2016 being quite a notable period for these calls.
I'm thinking to my geography, but Southern California is a bit of a different climate to Northern California, right?
Northern California is quite wet and woody, from my understanding. Shout out if you are from Northern California and want to correct us. So out of the 61 calls, 5 individuals did develop organ failure, 3 of which died, including a 60 and 31-year-old male and a 35-year-old female who was treated with hemodialysis, which wasn't successful. And the other 2 individuals who did survive, who developed the organ failure, did end up needing liver transplants. Amatoxin-containing mushrooms were only diagnostically confirmed in about 23% of patients. Of the 5 that developed organ failure, this was confirmed in 40% of those and was confirmed in 21.4% who didn't have organ failure. And these were all confirmed by mycologists. So I'm assuming that people had taken in bits of mushroom or had had photos of the mushrooms that they'd ingested, and they were ID'd that way rather than through looking at the toxin in people's blood or urine.
Because actually, for a toxicology podcast, we've actually talked relatively little about the analytical toxicology of these mushrooms, haven't we?
I know.
We will jump into that in a moment.
10 of these individuals were below the age of 4. 8 had spontaneously ingested mushrooms while outside, but remained asymptomatic, 2 of which were fed mushrooms and did develop symptoms, with 1 of them requiring a liver transplant. So in general, across the 61 cases, mostly men were affected, with the average age being 34 years. Most of the ingestions involved raw mushrooms rather than cooked. The majority of individuals consumed these without also consuming alcohol or other potential liver toxins. Generic symptoms included nausea, vomiting, diarrhea, and abdo pain. Those who developed organ failure had quite raised LFTs, twice the upper limit of normal, and raised INR, which is a marker of disordered clotting.
So all suggesting their liver was not working as it should.
Yeah. And quite fitting with the timeline we know about mushrooms, the time from ingestion to symptoms was documented in 44 cases, and in 35 of those, symptoms occurred between 6 and 48 hours after ingestion, with a median time of 12 hours. And quite a few of these patients, 15, in fact, developed elevated liver enzymes before their arrival to hospital, and that was between 3 and 96 hours post-ingestion. So again, that delayed presentation, quite evident in these cases.
So let's talk a little bit about testing for amatoxin. As you said in that data set, the cases that were confirmed as being related to death caps were actually confirmed by mushroom experts looking at the mushrooms rather than actual analytical testing. And there's actually a couple of good reasons for this, isn't there? Firstly, not everywhere has got methods set up to test amatoxin. This is not a common poison that most labs are going to be set up to test for. But even if you had the best method in the world, the time frame and delayed presentation between ingesting these mushrooms and actually ending up in hospital, given that the toxin itself clears from the bloodstream relatively quickly, and we're talking serum half-lives of about 2 to 4 hours, sometimes quoted. By the time somebody actually gets to hospital, there's often no amatoxin left to be able to detect in the blood. I think there have been some tests, haven't there, looking at urine and even a dipstick method.
Yeah, and I remember reading a paper in, I believe it was JAT, about urine dipsticks for amatoxin. But again, with people presenting so delayed, I don't know how useful they will be. Like if you get a negative dipstick result, doesn't completely rule out the possibility of death cap mushrooms being involved.
Well, actually, going back to the Erin Patterson case, I believe at least one of the patients did test positive for amatoxin. Is that right?
Yeah, in the case of Don Patterson, who was the one who needed a liver transplant and still unfortunately passed away, they did detect amatoxin.
So it was analytically confirmed.
Mm-hmm.
So one of the other details that came out of the Erin Patterson trial, and I know I said I didn't want to get too hard into details, but this particular point caught my attention, and it really got me thinking, actually, that some of the evidence related to phone positions and the use of an app which was set up for citizen scientists to document plant locations and other wildlife and natural things for the purposes of monitoring biodiversity.
Yeah.
And it has come under a little bit of fire because there's suggestion that you could use the app to look up the presence of poisonous mushrooms if you had malicious intent. And I'm really torn on this point because I see where both sides are coming from.
Yeah.
I feel like the location of poisonous mushrooms should not be a secret, but I also understand entirely why people say that we should be hiding the location of poisonous mushrooms.
Yeah.
I think from my perspective, I actually had a case going back a couple of years where you're just going to have to trust me. I had good intent. I needed a hemlock plant and I was able to find one by contacting a friend who told me where a hemlock plant was. Now, I'm qualified. I feel like I'm okay. But again, that sort of information, I could see how that could have negative implications in the wrong hands. So I do see where both sides are coming from. Should dangerous foraging data be fully public?
I don't know what a fully public. I'm really torn on whether it's helpful or harmful. And it entirely depends on whose hands it's in.
It's completely fair. There may not be a right answer to this question. It's okay. So another thought I have had relating to liver failure is that it's relatively well established that a decent chunk of acute liver failure that ends up in death or transplant, something like 15% or so, is actually of idiopathic cause. No cause is identified. The question that I have is a chunk of these mushroom related?
Oh, that's a good point. Some of them might be, especially with people ingesting mushrooms and having sort of that delayed presentation. It might not necessarily be put down to that event and therefore gets put down as idiopathic. How many of those that relates to, I don't know.
So I think this kind of leads us to one of the takeaway messages of this episode, doesn't it? If you are a doctor listening who works in emergency departments and you are faced with a patient who's got GI symptoms followed by liver failure or liver failure and they say they had GI symptoms a little while before, I do think mushrooms, particularly if they are an outdoorsy person that's been out in the woods recently or perhaps even admits to foraging, certainly ask the questions. Because I think there could well be a number of cases that are falling under the radar a bit just because of the time frame. And I think there is one obvious other take-home message from this episode, isn't there? And that is, if you are foraging for mushrooms and you're not sure what you picked up and you're not a mushroom expert, maybe don't risk it.
Yeah, I think that's a really important point.
I'm all up for people enjoying nature's bounty, but clearly death cap mushrooms are a very significant risk. So I think we're going to wrap it up here. I hope you've enjoyed listening this week and that you found some of it insightful at least. If you've seen cases of mushroom poisoning, do get in touch.
Hope you all have an amazing week, and we'll see you next time. Bye!